Namaskar and welcome to the Green Habits by Dr. Chinmay Swami. The Green Habit is consistent of two parts. One is to promote a sustainable healthcare through the Green Hospital framework by doing energy audit, water audit and carbon footprint calculation. And second part is by adopting some green habits for the health effects of climate change towards maternal and child service. I will prepare the videos and upload regarding these two important things.
Namaskar. Welcome to the Green Habits by Dr. Chinmay Swami. Why the Green Habits? Because to turn the sustainability into action. So we have started a series of webinars in the form of 4 videos. And the 4 videos are talking about 4 things. One is today whatever we are doing is the introduction part, which is focusing on the why energy audit, water audit and carbon footprint calculation matters. And my subsequent videos would be on how part, and there will be 3 videos on it. Second one on the energy audit in the healthcare facilities, how we are going to do it. Third one, how we are going to do the water audit in the healthcare facilities. And the fourth one is the very important part, how we are going to do this carbon footprint assessment and calculation. So, welcome to the today's session, and this is on the how part. And the topic is why the energy audit, water audit and carbon footprint calculation matters. Before I start my formal presentation, the outline of the presentation is why, what and how. Why I have emphasis on why? Because the clearer the why, the easier the how. You are getting my point. So, second thing, I am going to focus on this what part and few points for how, because the four of the videos, they are actually interconnected. So, few of the points from how part I am also going to include it in this video. I am going to include in this video. Okay. So, the introduction part. Why are we here today? So, you know that the climate change this is the one of the greatest public health challenges of our time, and healthcare facilities, they are actually consuming, rather I should say we are actually consuming a significant amount of energy, water and other resources, and we are contributing to greenhouse emissions. The second point, why? Because the entire session would be on why. Why we are here? Because if you cannot improve what you do, we cannot improve until and unless we measure. So we need to understand this why part, why this assessment matters, and to learn how to conduct them using practical tools and methodologies. This video, the four videos, not only today's video, all my videos, they are going to help you to understand why to conduct energy audit, because it will improve the efficiency, the energy efficiency, it will reduce the energy cost and it will optimize the energy use. Why to conduct a water audit? It is going to conserve the water, it is going to identify the leakage, and it is going to strengthen the water security. Why I have used here water security, I am going to discuss in my subsequent slides. Now the third part, why the webinar, the videos is also going to tell you why to calculate carbon footprint, because it is going to measure the emissions. We are going to identify the reduction opportunities, and we are going to support the climate resilient healthcare. Remember, every unit of energy saved, every drop of water conserved, and every kilogram of carbon reduced. These are contributing to healthier people and the healthier planet. This is the actually motto of doing this kind of videos, and that's why the introduction is based on this why. Okay, now my next slide. All of us know that the global warming factors, okay, because these are the main thing, and these factors actually, these are those kind of environmental alterations are caused directly and indirectly by the human activities. Okay, and this is primarily since the Industrial Revolution. Now, I'm going to discuss some of the points from the recent news. In 26 April 2026, during the Man Ki Baat, our Honorable Prime Minister, he focused on the renewable energy and wind energy. And let me give you one piece of information that India stands globally third in renewable energy installed capacity, and this is as per the IRENARE statistics. This is I am going to highlight. Please see this IRENARE statistics 2026, and this is as per the data uploaded till December 2025. Okay, and one of the data from CAC is nothing but Center for Science and Environment, and they are actually having a publication known as Down to Earth. And here that they are saying that the satellite data showing Secunderabad and Hyderabad, I am highlighting those two cities, Secunderabad and Hyderabad, among the world's biggest methane emitting landfill sites in 2025. So please remember those points. Why we are going to do this kind of audit? Why? Okay, and so I am going to discuss on why. And next, see the recent news from July. Please see this highlighted portion. This is regarding ozone pollution, and this is spreading across Indian cities. And this again I am highlighting some points from this CAC analysis. Okay, again this is Center for Science and Environment, and what they are saying, and this is a comprehensive 6-year data analysis that they did from 2020-21 to 2020-26, and what they are saying, Delhi NCR emerges as the largest regional hotspot for this ozone pollution, followed to that Chandigarh, Jaipur, Ahmedabad, Mumbai, Chennai, Bengaluru and Patna. They are the severely affected states and UTs. You can imagine, okay, how we are actually contributing to this kind of carbon emission. Okay, and all the points are evidence based. So that's why I try to insert the link of the source of the data. Now coming to my subsequent slide, the next why we should do this energy audit, water audit and the carbon footprint calculation, because we need to take part in this to get the sustainable development goal, that is SDG 13. The SDG 13 is all about climate action, and the SDG 13 is talking about 4 targets. So the target 13.1 is talking about how to strengthen the resilience and adaptive capacity to climate related disasters. Now please see the second point. The second point is all about the target 13.2 is integrate climate change measures into policies and planning. So in few of my slides I try to incorporate what are the policy things into it. Okay, now the third thing is related to build knowledge and capacity to meet the climate change. So today we are doing the same thing. Okay, we are trying to create the awareness. We are trying to build the knowledge, the capacity, how we are going to mitigate the climate change. Okay, now the fourth target is 13.4 is talking about the implementation. Saran ma'am, basically going through any kind of presentation or attending any kind of training or capacity building, this is not going to solve our purpose. After that you need to implement. So 13.4 is talking about whatever you have in your policy, whatever you the knowledge you have whatever capacity building you have, so you need to implement. So these are the next why. Okay, now the other SDGs are why I have incorporated, because again and again I would like to use this word why I have used other SDG goals, because the SDG 3, which is talking about good health and well-being, the SDG 6, which is talking about clean water and sanitation, and the SDG 7, which is talking about affordable and clean energy. all the three SDGs are interrelated with this SDG 13, because ultimately we are going to reduce our carbon footprint, we are going to improve our energy efficiency, we are going to improve our water scarcity. That's why this SDG 13 is interrelated with SDG 3, okay, SDG 6 and SDG 7. So next, we are going to discuss why it is the supreme need of the hour. First of all, from international point of view, so if you see one report by Healthcare Without Harm, what they said in September 2019, they published a report, and the report contains that the health sector contributes 4.4% to global greenhouse gas emission. Please focus on this point. That's why it is imperative that healthcare acts now to begin to reduce the climate footprint and move towards the net zero emissions by 2050 or before. Okay, that's why we are focusing on energy audit, water audit and carbon footprint assessment, because without any measurement we cannot improve. Okay, so evidence from some of the countries like Brazil, what they are saying, the data is saying that Brazilian hospitals, they are consuming 10.6% of the energy utilized for the commercial purpose. According to NHS is for England, National Health Service in England, this is responsible for almost a quarter of the total public health sector emissions. This focus on this point, 18 million tons of this carbon emission per annum. And in the similar line, US health sector, again, this is the largest consumer of the carcinogenic chemicals. Now, coming to our country, India. Why this is the need of the hour? Now, this is the overview of our country from, so again, evidence-based. According to CDC is nothing but Center for Disease Control and Prevention under Ministry of Health and Family Welfare. What they are saying, so there are some effects of climate change, maybe direct or indirect. So what are those? Cardiovascular diseases, respiratory illness, premature death, extreme weather events, changes in the prevalence and infectious disease. Again, what they are saying? The CDC is saying between 2013 to 2050, climate change is expected to cause approximately this number of additional deaths. Please focus on this point, okay? And due to what? Due to malnutrition, malaria, diarrhea and heat stress. Now coming to next, it's something regarding biomedical waste management. According to the Central Pollution Control Board report 2020, the total quantity of BMW generation in India is approximately 656 tons per day. Imagine how much of actually waste we are generating and how we are responsible for this carbon emission. So that means if we are responsible, we need to do something to reduce that. So for that, we need to do some kind of audit, okay, so that we can have that kind of opportunity to reduce that, okay, and so that we can implement. That's why, again, in India, the commercial sector, which includes our health sectors as well, it is consuming the 7.58% of the total electricity, okay. Please see how much of electricity we are consuming. So that means we need to play our role to reduce that. And for that, we need some kind of energy audit. Okay. So I am moving to my next slide. So as of now, we have discussed the climate change. Then the SDG 13, they are interrelated with some three other SDGs as well. Now the international point of view, okay, overview, and the Indian overview. Now the type of roles we can have, okay, the intervention we require. So role of health sector, some of the basic measure improvement in hospital design, introduction to sustainable waste reduction and management strategies, because those points will come from our audit part. Okay, sustainable use of natural resources such as water and energy, purchase of such products and chemicals which have minimal impact on environment. So here I am going to give you one piece of information. This is nothing but SPP. SPP is Sustainable Procurement Policy. Under that, the Government of India, the Finance Division, they have actually published a gazette notification that the energy efficient lights, so this kind of thing you need to purchase, and all the things are available, all the eco-friendly things are available in the GEM portal. Okay, so this is something about this SPP. Okay, because we are going to have this kind of improvement, so before that we need the audit. And again here they are also reflecting on this point, natural resources like water and energy. Okay, so the last slide is talking about intervention required from a hospital site. Okay, so why climate smart healthcare facility? Okay, why? Because we are discussing on the point that health sector contributing the carbon emission. The climate change affects healthcare delivery. Why we need a green hospital? Why we need a climate smart healthcare facilities? Because the rising energy and water cost, we can reduce it. Whenever we have that kind of audit, we have a baseline data. See, till we have that kind of data, we cannot do any kind of improvement. We cannot reduce the data, the cost, until and unless we have that kind of baseline survey. And that baseline survey would be coming from those kind of audit. Okay. And the most important thing is that we need to achieve this sustainable development goal. So this is the need for the resilient and sustainable healthcare system. So whenever we are talking about this green hospital concept or this climate smart health facilities, internationally also and India also, we have certain kind of green hospital framework. So now we are going to discuss on those kind of framework and please we need to focus on some points. All the most of the green hospital framework, they are focusing on energy, water, your biomedical waste management and carbon footprint, and we are going to see in my subsequent slides. Okay, so what is this green health facility framework? Whatever I have just mentioned, they are focusing on energy management, water management, waste management, this carbon reduction. Again and again I am just highlighting this point, and ultimately all this point is going to lead to this climate resilient, is going to lead to this sustainable healthcare. Okay, so see these three things, this energy, this water, this carbon footprint along with this waste management is common in all the green hospital framework. So one by one we are going to discuss on few of the framework. Number one is BREEAM. BREEAM is nothing but Building Research Establishment Environmental Assessment Method, BREEAM. Basically it is followed in Australia. Please see this. They are actually projecting, they are having a scoring thing, and the scoring categories are energy, water, health. And the key aspects of BREEAM rating system are, they are evaluating the management, they are evaluating health and well-being, they are evaluating energy, transport, water, waste, land use, ecology and pollution. Please see this, the last line, the weightage. The highest weightage are given to energy, 19%, and next to that 15% health and well-being, because your greenhouse gas emission is directly or indirectly it is affecting our health. That's why energy audit 19% and they have given the 15% score to health and well-being. Okay. So now coming back to our next green hospital framework, this is LEED. LEED is nothing but it represents, this is under the US Green Building Council. That means LEED is practiced in US. Again, what it constitutes? They are taking care of the sustainable sites. Again, water, energy, along with this ozone depletion. And see this fourth line, 1, 2, 3, 4, 5 point. Environmental quality. This includes carbon dioxide monitoring and innovation and design. That means again this BREEAM also, they are focusing on energy, water and health and well-being. Again this LEED, they are also focusing on water efficiency, energy and carbon dioxide monitoring. Okay. Now coming back to our India. In India we have IGBC. What is IGBC? Indian Green Building Council. This IGBC, they are having a green new building rating system, and they are also focusing on this energy efficiency, water conservation and indoor environmental quality. Along with that, they are focusing on sustainable architecture and design like natural ventilation, how we are going to use that. Okay, building materials and those kind of materials, those are less emitting carbon emitting. They are using less emitting carbon emission. Next, any kind of innovation and development. Okay. Now coming back to another innovation. Rather, I should say the ministry, see, IGBC is for all the things. It applies to all kind of building. But here we are talking about green hospital. Okay. So, Government of India Health and Family Welfare, they have started eco-friendly theme under Kayakalp Incentive Scheme. So what is this Kayakalp Incentive? Basically, that was started in 2015. Earlier, it is talking about your neat and cleanliness, sanitation, waste management, infection prevention. Later, beyond the boundary part has been incorporated. But in 2019, one national health program came up. This is called as National Program for Climate Change and Human Health, and that national health program but is focusing on 3 parts. And one of the part is to develop green and clean hospital in India, and to actually combat that situation. And according to that objective 3, okay. So eco-friendly started in 2020-21. So what are the components? Again, this eco-friendly theme under the Kayakalp, it includes energy efficiency, it includes water conservation, it includes water audit. It is including air and noise pollution, 3R concept, save earth and environment, and health and well-being. And you must have just thinking where is the carbon footprint? I am going to have this slide also, because in 2020-21 under this eco-friendly theme, those points are incorporated. Carbon footprint calculation, this point was integrated in 2020-24. Before that, I am going to discuss on this energy efficiency part, whatever included in the eco-friendly theme. So my next slide is on this. See, under this eco-friendly theme, this you can see energy efficiency. What it is saying? Energy audit. First point. This is saying about your how the facility is going to promote low energy lighting, the lighting control in the common area, how to maximize the uses of natural lighting, and on-site renewable energy generation in the facility. Okay. And again, what they are saying under this energy efficiency, no energy consuming equipments are switched on when not in use. That means this is one of the green habits. Okay. So small things. Okay. So whenever you are not using something, please just switch on. So this is This is a small thing. So that's why green habit. You can do it in your hospital, you can do it at your home, you can do it everywhere in your workplace, at home, everywhere. That's why green habits. Okay. So if you go to water appliances, whatever energy appliances like your water heater, your AC, whatever you are purchasing, that has to be energy efficient. That means, according to Bureau of Energy Efficiency, that has to be 4-star or ever. Okay, BEE, Bureau of Energy Efficiency. Okay, so next, coming to my next slide. Now, I said in 2020-24, under this eco-friendly theme, carbon footprint estimation was integrated. What the line is, the facility endeavor to meet climate neutral goals as per the global goals. That means in alignment with SDG 13. Okay, that's why. So may it be your BREEAM, may it be your LEED, may it be your IGBC, may it be your eco-friendly theme. All are focusing on 3 things majorly. What are those? One is energy, second one is water, and third is carbon footprint. That's why we have started with why to conduct energy audit, why to conduct water audit, and why this carbon footprint assessment and calculation matters. Okay, because all are saying the 3 things are in common. Okay. Now, this is one point the eco-friendly theme is talking about, this green space, because this is all about your health and well-being. Okay, again I am highlighting one point. The health facility has indoor plants, those are having oxygen emitting quality, because this point is related to your emission, greenhouse emission. Okay, the more you have this oxygen emitting plant, the less is going to your emission. And now one more word has been incorporated. Okay, earlier there was herbal garden, now it is carbon garden. Okay, it is yet to be implemented in the healthcare facility, but I would give an example of Delhi University. In one of the department, they developed this carbon garden. This is nothing but this garden is with all the trees that are emitting oxygen, okay, and that are absorbing carbon dioxide. This is all are related to how we are playing our role to reduce the carbon emission. And do you think they have done it like this? No, they might have done some kind of audit. They might have calculated their carbon footprint calculation. Okay, if you can go to Delhi University website, you can see the entire project related to this carbon garden. Okay. Now, again and again, I'm talking about audit. Saran ma'am, audit is not about the data collection. It is about the decision making for sustainable healthcare system. Okay, if you measure, you can take a decision. You can have the opportunity to see how we can reduce our energy use, how we can conserve our water, and how we can reduce the carbon footprint. That's why I said the initial presentation, the outline would be why, what, and how. Okay, because this how is related to the why. Okay, so now coming to this what. Okay, so before going to my next videos where I am going to discuss on the how part, before that you should know what. Okay, again this what part is it's connected to this why part also. Okay, so what is energy audit? It is nothing but systemic examination of energy use to identify the conservation and opportunity. Remember the first slide. Okay, this is going to give you the opportunity. Until and unless you measure something, you cannot improve. Okay, you can measure something, you can have some kind of action plan, you can identify the energy conservation opportunity, and the objective is that to reduce the consumption, to reduce the cost, because for everything vitamin M means money. Money matters. So you should actually decrease that part also. And at the same time, we have to improve the energy efficiency, and this emission, we need to reduce the emission. So again, this energy audit is related to this, to reducing this carbon emission as well. Okay. So the next slide is talking about the energy flow in a hospital. Please imagine you are in your workplace, whatever, may it be a government hospital or a private hospital. So we have a main grid. Okay, we have a 3-phase connection. We may have 33 kV electricity or more than that, depending on your bed capacity, bed strength. And from that, electricity is being distributed to all the departments, and then to all the instrument equipment, whatever you are using, and then we are consuming. Correct? This is the energy flow. Okay. Why I am saying this? Because from this only we are going to have how to do this energy audit. That's why I am just giving the few of the points to reach to this how part. Okay. Because energy audit is going to do in the equipment and instrument, where in the department through this consumption analysis. So all are interrelated. Okay, so before that, you should know your energy flow of your hospital. This is the first thing. Why energy audit? And this is the first thing, you should know the energy flow of your own hospital. Now, types. There are 2 types majorly. Okay, one is walkthrough audit and the second one is detailed audit. Sir and ma'am, this walkthrough audit is something like that. For an example, if you are taking a round in your facility, okay, so you just observe that the in one of the OPDs no one is there, but all your lights are switched on. Okay, all the fans are switched on. So what we can do? You just go and switch off all this thing. That means instantly you took this corrective and preventive, your corrective action. Okay, because walkthrough, like what we can. So in a simpler way, this walkthrough audit is nothing but is short term work, and this detailed audit is for long term. Okay, so I can give you example from your not only from hospital, from our home also. Like we have 2 to 3 rooms. Okay, so we are watching a movie or something in drawing room, so we need to switch off all the lights and fan of the other room. Okay, so this is nothing but a walkthrough audit. We are just roaming around in your home. You saw this, like all are sitting in drawing room, but all the other rooms, the lights and fan, they are in running mode. Okay, so you just go and switch off all these things. This is nothing but the short term. But the detailed audit, okay, the detailed audit part, today I am going to give some points, but in my next video would be on this detailed audit, energy audit. Okay, so for this detailed audit, what is required? What is this detailed audit process? Number 1, planning. Number 2, data collection. Number 3, site assessment. Here I will stop and I will give you an example. Okay, so why this site assessment? Why this planning? Why this data collection? Planning is required because until and unless you plan something, you cannot do, and you cannot check, and you cannot act. It is something like PDCA. Plan, do, check and act. So for this, you need to plan something. And for do, you need to collect the data. And for do also, we need to select the site. For example, so we have a generalized OPD and we have specialist OPDs as well. So the process of audit in, for an example, we are going to have the energy audit in our OPD. That means we have selected a site. our first site would be OPD, and the OPD is going to include the general OPD and as well as the specialist OPD. And for this site after this site selection, you should have some kind of submeter in both the OPDs, okay, and for each and every OPD. That's why this site selection is important. After that, you need to analyze how? By seeing the electricity bill, by seeing the meter, sub-meter. Okay, so these are the prerequisites before you conduct the energy audit plan. So before that, you can have your, you can see. So your electric bill is going to give you the planning. Okay. Then depending on that bill and this meter reading, we can analyze. See, your specialized OPDs, they are giving you more electricity bill or your general OPD. Okay. And based on that, you can give the recommendation why you are having this kind of high energy bill. Maybe the same example, your one of the OPDs are the timings are over, but the fans or lights, they are running on and on and on. So, and next, the action plan. This is the process of a detailed audit plan. This is nothing but PDCA. Okay. Now, data. What are the data we require? First of all, electricity bill. Second, DG consumption. Okay. Why? Because you are utilizing diesel. Okay. Solar generation, if you have. Building area. Why building area? I am going to give you one point that is known as EPI. So I am going to give you in my subsequent slides. Occupancy and your equipment inventory. Occupancy means it depends on your energy audit will vary depending on your bed strength, depending on your occupancy of your particular ward. If you are going to have the energy audit in your IPD, maybe your surgical IPD is having more occupancy than your medical IPD. So occupancy, that you need to collect the data on occupancy as well. And equipment inventory. How much of electrical switch? How many fan? How many AC? How many exhaust fan? So this is nothing but equipment inventory. Okay, these are the prerequisites. Okay. Now we know the process. We have the data with us. Now we should know where we are consuming the energy, the major area of energy consumers. First of all, your heating, ventilation, air conditioning, your lighting system, your medical equipment, your laundry, your CSST. Okay, because there, water pumping, there we have installed the electrical equipments. Okay, so I have mentioned the percentage. So depending on your occupancy, depending upon your geographical area, the percentage would vary. But the percentage like means that may be 30% or 40%, but the major areas are this: the central AC area, your lighting, your medical equipment, your water pumping, your laundry, your CSST. Now coming to next. Here, why this? You need the data of the build-up area. Remember, data. I am going to this section. Build-up area, because this is the part of the energy performance indicator, EPI. This is being calculated by energy consumption and build-up area. Okay. So this is the just please remember this EPI. This is going to help you during your energy audit. Okay. Next, equipment inventory exercise. That means kind of equipment instrument you are using, quantity. Means in OPD you have 5 to 10 switch, but if you go to any critical care areas like ICU, SNCU, you must have more switch like 15 ampere, because ICU and SNCU, they have the more as instrument equipment, okay, life-saving instrument equipment rather than OPD. So maybe the quantity of your equipment is much more. Okay, so that means we need to do this equipment inventory exercise. Okay, what are the your equipment instrument you are using, the quantity depending upon your area, or your, may it be your OPD, your IPD, or your critical care units. Okay, critical care units. So critical care units, they are going to have the most of the your energy consumption. Okay, now consumption. Okay, so this is going to you need to check your bill, and that bill is depending upon your submitter. Okay, so first thing your energy bill, second thing your submitter, and this is the part of your equipment inventory exercise. Okay, because you need to have your separate submitter for your ICU, separate for SNCU, separate for OPD. Okay, then you can have this kind of consumption analysis. Okay, because this analysis is going to give you the action plan. Remember, this is analysis. First is planning, second is data collection, third is site selection. You are getting my point. Why this data collection is important? Because your quantity and your energy consumption would vary depending upon your site, and after that you need to analyze them, and this analysis is going to give you the recommendation. Okay, so all the slides are interrelated. Now we have all the things, and after conducting this, and this energy audit is going to give you this energy conservation opportunity. Again, this is one of the why. Okay, why energy audit? I am just writing EA, energy audit. Why? Because this is going to give you the energy conservation opportunities. So what are those opportunities? We can have LED light, we can install occupancy sensors. Okay, we can have efficient your heating, ventilation, air conditioning. We can have solar panels. What is this occupancy sensors? If you go to private corporate hospital, or recently I have visited to one of the actually airport. If I remember correctly, this is Jaipur airport. Believe me, the toilet of that Jaipur airport is having occupancy sensors. Okay, I enter to the toilet, ladies toilet, and lights are on. Immediately I am out of the toilet, so lights are off. Okay, so if they can do, so we can. Okay, that's, and before that we need this energy audit, so we can think of it. And again, this is the small green habits. Okay, what we can achieve with a small amount of our investment. Okay, but for each and everything, for switching off the lights, no investment. This is the easiest greener habit. But to install this occupancy sensor, we need some kind of fund. But this is one of the green habits. Okay. Now, coming back to this is another opportunity. After conducting energy audit, we can have this rooftop solar. We can have this solar water heating. So what will be the benefit to us? If we are going to conduct the energy audit, the benefit would be the cost would lower. And again, reduced emission. That means your energy audit is related to you to reduce your carbon emission. Okay, so that's why energy audit, water audit, and carbon footprint assessment, they are very closely interrelated. How? I am going to tell you. Okay, now coming to this keynote message. Okay, on this energy audit. What is that? Measure, monitor, manage. Measure through energy audit, monitor it and manage it through some opportunities. Okay, now coming to this water part. All of us are very much aware about this importance of water, not only in the healthcare facilities but also in our day-to-day life. So if you talk about the hospital, the importance is for patient care, for the critical care units, for laundry, for labs, and for this sanitation. Okay, may it be the critical units are the most important part, but this sanitation is playing the most vital role, because until and unless sanitation is there, you cannot give the quality patient care. You cannot run this OT. You cannot run this lab. So that's why sanitation, we need water for that. Okay. Now, why water audit? Again, to reduce the cost, to reduce the water bill. See, we have the energy bill for the hospital. We have the water bill as well. Now, why to conduct water audit? Water security, climate resilience, and some of the regulatory compliances as per the Water Act. Okay, water security. What is that? Okay, so that means we need to conserve. Okay, because some of the countries in the world, not only some of the countries in India, if you go to Rajasthan, the Jodhpur, Jaisalmer, Barmer, they are struggling with this water. Okay, they are actually in the rural areas, they are walking miles and miles away to get that water. And I can quote an example from those sites that they are getting this drinking water twice in a day. They have a specific day for that, and before that the municipality, the local area, they are giving a notification. Yes, today this area is going to have this drinking water. Okay, through this tanker. So, and just see the kind of water scarcity is there. So we need to secure the water. We need to conserve that. Before that, you need to audit. Okay, and same applies with to our hospitals as well. Okay, now this is something related to this framework. For this audit, we need what is the source of the water, how we are going to how we are doing the storage, what is the distribution, how we are utilizing it, wastewater, and the reuse. Similarly, in the energy audit part, the energy flow, your grid, your distribution, your instrument, your departments, your instrument equipment, your consumption, then your analysis. And similarly, for water, the source, may it be your borewell, may it be your water tank, okay, and how you are going to store it, how you are distributing to the different departments, okay, how you are utilizing. And so this water balance concept, this is the main thing in your water audit. Okay, this is nothing but water in is equal to water out plus losses. That means we need to balance the water through some kind of water conservation opportunities. Okay, so again, what are the sources? Again, we need to do the same thing. PDCA, Plan Do Check Act. Okay, for water audit, WA means I am just writing this like this. Water audit, we need the data. We have planned something. We have the total outline of the distribution of water pipes, the storage and distribution, everything. Now the data. Data from where? Source, borewell, municipality supply, how much we are getting, tankers, any other sources, and now this meter reading. That means for whole hospital 1 meter, and for the different departments again this sub-meter. Similarly, what we have discussed in the energy audit, for water audit as well, this sub-meter is required. Okay, now the major water use areas, may it be in our home, your workplaces, or in your hospital, toilets, laundry, OT, kitchen, gardening, those are the major water consuming area. That means this is the site assessment, okay, for conducting water audit. Similarly, what we have discussed in the energy audit, okay, so site assessment, so toilet, laundry, OT, kitchen, or gardening, we can conduct our water audit for those places. Okay, so this is something related to water performance indicators. Okay, 3 points. Now, how we are going to approach to this water audit? So we are going to have this water audit through metering. One is your main meter and then your submeter, because we are having a water bill. This main meter is related to your entire hospital and submeter for your departments. Okay. So remember, that means we need to install this submeter in this major water uses area, like your toilets, laundry, OT, kitchen, and how much water you are utilizing for gardening. Not only OT, any kind of your critical care area like labor room, your OT, your ICU, SNCU, okay, depending upon your facility, okay, and scope of your facility. Okay, so yes, metering, you have meter, you have submeter. Now you need to find out where the leakage is being, where is the leakage? Maybe in toilet, maybe in one of the pipe in the OT or OPD or emergency. You need to see all the fixtures. You need to see the storage part. Okay, how far it is intact. There may be some leakage in the storage, he said. Okay, and your wastewater system. Okay, so you need to collect data from those places. Okay, so through how we are going to do this? Leaking taps, overflowing tanks, pipeline leakage. This is some of the points for your leak detection for this part, for your leakage. Okay, so now we have, for an example, we have a toilet in OPD. Okay, so we have 4 toilet plus 1 toilet for your special able friendly atmosphere. Okay, and leakage, you observe the leakage in one of the toilets. Okay, that means this is the point you have detect the leakage. Now this is the term, this is the point for the water conservation measures. That means we can have the sensor taps, we can have these low flow fixtures, and we may have dual flow systems. Okay, so this again, the sensor taps, another green habit. Okay, small things with small investment, we can have those kind of green habits. Okay, so and all these things, this opportunity will came once you have the water audit data in your hand. Okay, that's why water audit is playing a vital role to reduce your carbon footprint calculation along with your energy audit. Okay, so again and this is the very famous water conservation method in India, this rainwater harvesting system. What is that? It's nothing but catchment, storage, recharge. Okay, so it is very familiar in if you go to Karnataka, Bangalore, I'm not remembering his name, but he is known as Waterman. So he has the rainwater harvesting system in his own home. So we have rainwater harvesting system in our facilities. Okay, so this is coming from our ancient times. If you go to Fatehpur Sikri, if you go to any kind of fort, go to Red Fort, see the system of rainwater harvesting system they are doing. So how they are doing, okay, since that time. Okay, so today we are struggling to implement that. This is nothing but one of the green habits we are doing since so many years. Okay, so again and again, green habits, small green habits is going to give you the sustainable healthcare to all of us. Okay, so now wastewater reuse. So remember one of the slide I said ki wastewater. Okay, what is the significance of wastewater? So because we can utilize this wastewater during flushing, in our gardening and cooling towers. That means this is one of the opportunity for water conservation, and this opportunity you are going to have through this audit only. Okay, now, so as of now we have discussed on energy audit and water audit. Now we are going to discuss on something on climate change and healthcare. So why I have given this the headline? Because now we are heading towards carbon emission. Why carbon emission? What is carbon emission? What is the significance of doing this assessment? Okay, carbon footprint calculation. Why? Again, healthcare contributes significantly to this emission, and hospital can become a climate leader. We all of us are leaders. Okay, we can become the climate leaders through green habits. So what are the green habits? As of now we have discussed, like just switching off the light, reusing the wastewater. Okay, so installing some sensor lights, installing sensor tabs in our toilets. Okay, these are small green habits, but this green habits is going to give you a significant carbon emission reduction. Sorry. Okay, so what is carbon footprint? This is nothing but the total greenhouse gas emission from a facility. Okay, and this is the measurement scale. Okay, in terms of carbon dioxide. Now, what are the scope where we are getting this emission in our facility, in our hospital? Number 1, diesel, LPG. Diesel for your generator, LPG in kitchen. Okay, scope 2, electricity consumption. Wherever we are utilizing electricity, we are actually releasing some carbon. Okay, for an example, AC. Okay, fridge. We have AC installed in our facility. We have refrigerators. So if we are having this 1-star, 2-star AC and refrigerator, that means we are releasing much more carbon dioxide to our atmosphere. Okay, so that means, remember, eco-friendly thing. According to the Bureau of Energy Efficiency, you must have 4-star or above. Okay, rather I should say you should use 5-star AC, 5-star fridge. Okay, this is going to reduce the carbon, and this you are able to know only after doing this carbon footprint calculation. And this point is important because this is related to your energy audit. Okay, now the scope 3 is related to procurement. Remember, SPP, Sustainable Procurement Policy. Okay, so this is the opportunity. After calculating how much of carbon dioxide you are emitting, you can have this SPP in your action plan for further implementation, because only doing the audit is not going to serve the purpose. Implementation matters, and this why is leading to implementation. Okay, so source of the hospital emission: electricity, diesel, LPG, biomedical waste. Remember the Central Pollution Control Board data of 2020, more than 656 ton per day. That means we are emitting carbon dioxide. Okay, so that means your biomedical waste management is also responsible for increasing the carbon dioxide. Transport inside the facility. Okay, I am talking about inside the facility. Check. Okay, now again the same thing. We know Now we know the scope, scope of the emission. We know the source of the hospital emission. Now the data. Data will come from electricity bill, diesel records, LPG use, waste data, travel records, electricity bill from Energy Audit. LPG use. Then for an example, we have kitchen in our facility. How many LPG cylinders we are utilizing? Please just note down those points. First of all, we need this data. Before planning, because for this D of do, we need data. Until and unless we have the data, we cannot proceed for do. Because what to check? We need to check the data only after this audit or only after this carbon footprint calculation. Then only we can have this. We can take the action for further implementation. Now, the basic formula. So the formula of calculation of carbon emission is activity data into emission factor. What is the activity data? Activity data is nothing but your energy, your electricity bill, your water bill, your BMW generation data, but per year, per annum. And what is this emission? Sir and ma'am, this emission is this is according to the, like, for electricity, the energy department, for LPG, the petroleum department, and for this biomedical waste management, Central Pollution Control Board, they have defined the emission factor. And I am going to discuss in detail in my subsequent videos on this emission factor. Whenever we'll talk about energy audit, I will give you the entire emission factor of energy and what are the GOI, Government of India, what are the departmental guidelines. And for water also, for carbon footprint calculation also. So the emission factor we cannot decide. This is already decided by any government authority. That means we have the data of electricity generation per annum. We have the e-emission. We have the data for water. We have the data for your diesel. How much diesel we have consumed. How much of biomedical waste we have actually generated. And what is and then we need to calculate with this emission factor. So you are going to get this after this. Just try to understand this slide. So first of all, we have this formula. Carbon emission is nothing but activity data into emission factor. That means your energy bill plus your diesel consumption plus your LPG consumption into your emission. Emission according to guideline, departmental guideline. One by one. For an example, electricity, we have certain energy bill like kilowatt per year into the emission factor decided by energy department. That means your carbon emission for electricity for this year is 820 and this is the measure, tons per year. The diesel consumption into the emission factor of diesel is going to give you the emission of the diesel. This is your, for an example, 53.6. Now this biomedical waste, that means your, for an example, in 2020, 656 tons into the emission factor, whatever decided by the CPCB. So this is coming into 60. Now we have the carbon emission of electricity, the diesel and the waste. That means in total the carbon emission of my hospital per year is 93633.6 because I have added. First of all, I have multiplied into my data of how much energy, how much LPG, how much diesel I have consumed in a year. Then I have added the emission factor to get the carbon emission for each and every activity. And then I have just calculated those three. 820 plus 53.6 plus 60. It is coming around 933.6 tons. So this is my total emission of carbon in a year. So how to calculate per bed carbon footprint? If the hospital is having the bed strength of 300, simply you need to divide your per year carbon footprint emission divided by your bed strength. This is going to give you your per bed carbon emission. Here I have taken an example from a hospital. So for that hospital, the carbon emission is 3.11 ton per bed. So first of all, we need to have the energy consumption into the emission factor. This is going to give you your carbon emission in total. After that, you need to calculate by adding all the three activities. Now you have the total emission, and if you want to calculate per bed emission, then simply divided the total carbon emission in the year divided by your bed strength. That is going to give you the per year carbon emission, and this can be utilized for your benchmarking performance. That means in 2020-25, my carbon emission per bed was 3.11. So I can have one indicator that I have to reduce the carbon emission from 3.11 to 2.11. Okay, that means before that we need some kind of baseline survey, and that baseline survey we need to have this benchmarking performance, and all these things can be made only after we are doing some kind of audit in terms of energy audit, in terms of water audit, in terms of carbon footprint calculation, because our ultimate goal is to reduce the carbon emission. Okay, because as a healthcare professional, as a hospital, in a working hospital sector, this is our role to intervene, to reduce the carbon emission, to achieve the sustainable development goal SDG 13 along with the 3 other SDGs. Okay, so this is the emission hotspots: electricity, diesel, waste and transport. Now, after conducting this carbon footprint assessment, we have the opportunity to know the decarbonization strategies. This is why to conduct carbon footprint calculation, because after this we are going to have this kind of strategies. Number 1, energy efficiency. Number 2, renewable energy. How we are going to have this renewable energy? Okay. Waste reduction, sustainable procurement through SPP, Sustainable Procurement Policy, and green mobility. That means all these decarbonization strategies are nothing but our green habits. Okay. So, and ultimately we are going to have this net zero health facilities. Okay, and this is nothing but measure, reduce, replace, and ultimately you are going to have this net zero. Okay, so this is why for your carbon footprint calculation, which is interconnected with your energy audit, water audit, and how much waste you are generating, and what are the opportunity to reduce the waste through this reuse, recycling. Okay. And now coming to my next slide, and all this, the green hospital initiative and all these green habits, again and again I am utilizing these green habits, are in alignment with all the quality initiative by Government of India or by IGBC or internationally in BREEAM, LEED. Okay, any kind of green hospital programs are in alignment with, we can achieve those things through this green habit. Okay, that's why again and again I am emphasizing on this word green habit, because all the green hospital program we can achieve through this green habit to have a sustainable healthcare system. Okay, so this is the resource audit pathway. What is that? See this line: energy audit plus water audit plus carbon assessment. This is going to give you your action plan, which is going to give you the opportunity to have this resource efficiency and finally to decrease the carbon emission. That's why the video is talking about starting from your why energy audit, why water audit, why carbon footprint calculation, because ultimately these three, they are going to give you the resource efficiency, energy efficiency to decrease our carbon emission, because the ultimate goal is to reduce the emission. So the take home messages are what get measures get managed. So my first slide is that ki, if you cannot measure, you cannot improve. Okay, so my take home message for all of you is what gets measured gets managed. Okay, so again, your research audits improve efficiency and quality. And finally, this is done. Ultimately, we are going to hospital can reduce the cost and the emission in alignment with SDG 13 through green habits. And green habits will come after this audit only, because whenever you plan something, we need to implement something, and implementation can be done with this green habits with some investment, or some of the points like switch off the light without any investment. So after seeing this video, we can you may do some kind of exercise in your workplaces, in your hospital, may it be government or private. What are the action plan? What action plan your facility implement in next 30 days after doing this energy audit, water audit, and your carbon footprint calculation? Okay, so what action your facility is going to implement in the next 30 days? So this is something related to you can do it, you can practice it. Until unless you practice it, so you cannot improve yourself. Okay, the implementation cannot be like flawless. And so after this implementation, you might have this achieve this resource savings. Okay, like you can have this LED light, you can improve your heat, ventilation, and your AC system, water audit, solar panel, and you can reduce carbon emission to 10 to 30%. If you are improving your energy efficiency, you have installed this LED lights, you increase into 20 to 40%. Ultimately, this is going to help you to reduce the carbon. Okay, and you cannot have this resource saving potential until and unless you have this audit in place. That's why. Okay, so this is the thank you note from my side, including again this green habit. So why this video? Why the green habits by Dr. Chinmay Swai? Why this introductory video? Because together we are moving towards a greener healthcare. And thank you for watching this. Today's learning is the only beginning, because this is the first step. This is the first green habit. Okay, now I try to sum up some of the green habits. Switch off the unused lights and equipment. Save every drop of water. Reduce, reuse, recycle. Go paper light through digital practices. Paperless. Promote sustainable travel whenever possible. And support green spaces, environmentally responsible practices. So, green habits. I am just highlighting this place. Green habits. So, I have included my thank you note also. Let's build green habits everywhere, because we need to measure, to improve, to sustain. Green habit and sustenance. Okay, this is important thing. Now, taking the learning from this video, you can conduct audit, you can measure your carbon footprint, and you can implement all the improvements. So think green, act green, heal green. Together, let's build a sustainable and climate resilient healthcare facility. A green thank you to all of you to listen to my green habits. Think beyond today, protect the present, preserve the future. Namaskar.
Thank you for joining on this journey for a greener and healthier future.